A reverse shoulder replacement is a type of shoulder surgery that is typically used for who has specific conditions, like a complex fracture of the shoulder, chronic shoulder dislocations, severe shoulder arthritis, or a failed previous shoulder replacement surgery. It can also be used for those with extensive rotator cuff tears, where a standard shoulder replacement would not be beneficial. This type of procedure is called reverse because it reverses the anatomy of the shoulder. In a typical healthy shoulder, the ball portion is on the humeral head and the socket is on the glenoid. During a reverse shoulder replacement, the normal ball and socket relationship is reversed, an artificial ball is attached to the glenoid, and an artificial socket is attached to humeral head. This allows the patient to use the deltoid muscle instead of the torn rotator cuff to lift the arm. Here's a brief overview of how the procedure is generally performed. 1. Removal. The damaged portions of the shoulder joint are carefully removed. This includes the head of the humerus and part of the scapula, shoulder blade, where the socket is located. 2. Implant placement. The surgeon then installs the artificial socket into the humeral head bone, and the artificial ball is attached to the glenoid. This reverses the normal anatomy of the shoulder. 3. Recovery. After surgery, the patient may need to wear a sling for several weeks to protect the shoulder as it heals.